So welcome everyone, and thank you for coming to this session of Intellectual Journeys. And we're very pleased to have with us Arnold Platzker, who I'm sure is well known to a number of you. But in case he's not known to everybody, I'll do a short introduction. Arnold is a pediatric pulmonologist specializing in a number of things, such as asthma, cystic fibrosis, chronic lung disease in children, infant and childhood antecedents of adult lung disorder, and especially the effects of childhood exposure to cigarette smoke. He earned his BA at Brown University and his MD at Tufts. And after residencies at Boston City Hospital and Stanford, he came to USC in 1974. And from 1985 to 2012 was professor of pediatrics at Keck, and is now Professor Emeritus of Pediatrics. From 1973 to 96, he was the head of the Division of Neonatology and Pediatric Pulmonology at Children's Hospital, Los Angeles. From 1996 to 2003, the head of the Division of Pediatric Pulmonology at Children's Hospital. And I believe, Arnold, I'm right, that you founded that division. And he also has served as the president of the California Perinatal Association. He's been especially active in following, let's say, keeping an eye on the cigarette industry and exposing the dangers of cigarettes and more recently e-cigarettes to children and teenagers. And in fact, testified in a lawsuit brought by the state of Mississippi against the cigarette industry, which the state won for $8 billion. So he's really done a wonderful job of translating his expertise into real world results. And I should mention also that he's a member of the board of directors of the Retired Faculty Association. So thank you, Arnold, and turn it over to you. Arnold will tell us about his career and talk about it. And then we'll have time for questions, comments, discussion after that. So Arnold, thank you.
Thank you, Greg. I hope that I'll be able to bring you up to date on what I've done from the beginning of my career until today. I was born and raised in New York City. I don't know whether to be happy about that or sad. I never liked living in New York. My mother came from Allentown, Pennsylvania, and met my father in New York, who was born and raised in New York, went to Columbia undergraduate and Columbia Law School. I was born at a hospital that doesn't exist anymore. It was a maternity hospital on the east side of Manhattan. 3.5 years after I was born, my sister was born, and 4 months later, my father died suddenly and left my mother at 31 years of age with 2 kids to take care of. My mother had been an insurance agent, so it wasn't difficult for her to go back and become another life insurance agent. That provided some basic income. Serendipitously, my mother got a call from my uncle several weeks later saying somebody had seen my photo on his desk and wondered whether I would be a good Powers model. When he mentioned that the 1940 Powers paid $5 an hour proposing, my mother immediately agreed, figuring it would supplement her income and start a college fund for me. I was fairly successful. I was on the Crisco Can, the Western Union Telegram, in many clothing ads, and this served to bring a little bit extra income into the family. A year or two later, my mother met another insurance agent. They fell in love. He was a widower with a son 6 years older than me, and they got married. We moved to the Upper West Side of New York, and I attended Public School 54 at 5 years of age. It was a terrible old building that I'm glad has been ripped down shortly after I left there. When I was 7 years old, nearing 8, I was at a summer camp where there was a polio outbreak. The owners of the camp panicked, put everybody in railroad cars, and sent us to Pennsylvania Station in New York after calling all our parents. 6 days later, I came down with poliomyelitis and was admitted to the Willard Parker Hospital, which was an incommunicable disease hospital in New York, basically active during the polio season. I was gradually and progressively weaker and had paralysis of all my extremities. My mother was panicked, found that the actress Helen Hayes had lost her daughter to polio several years earlier. She contacted Helen Hayes, and surprisingly, they became friends. Helen Hayes told my mother that the major hope for rehabilitation would be being admitted to a specialized hospital for polio rehabilitation. It was called the New York State Reconstruction Hospital in West Haverstraw, New York. Helen Hayes lived in Nyack, very close by. She was very fond of the hospital and provided some resources for them financially. The hospital is now called the Helen Hayes Hospital, but I was hospitalized there for 15 months while being rehabbed. Had physical therapy twice daily. I learned to swim and swam daily. And by the time of discharge, I was able to walk without assistance. Subsequently, I could even run a little bit. My discharge physician was a doctor by the name of David Gorevich. He became my polio doctor until Eleanor Roosevelt wanted him as her full-time physician and traveling companion. He then handed me off to one of his fellows. While in 4th grade, I was homeschooled, my mother was looking for a good school where I could go, and her requirements were, had to have high academic standing and have swimming pool. She selected the McBurney School, which some of you might have heard about. It was where Catcher in the Rye was centered. J.D. Salinger had been a student a dozen years before me and was kicked out for non-compliance. The school was terrific. It was small classes, intensive instruction, monthly parent-teacher conferences, and every Wednesday we had cultural enrichment activities. And that meant going to museums. One of our students was the son of a Metropolitan Opera executive, so we went to Metropolitan Opera too. And this was really embellished the education. during my second year, as sophomore year in high school, since McBurney went from 5th grade through high school, I stayed on. And in my second year, I came home, answered the phone, and a voice said, "This is Branch Rickey. I'd like to speak to your mother." I knew Branch Rickey because I was a Dodger fan and he was the owner. I immediately put my mother on the phone. Turned out that our neighbor, a fellow by the name of Gus Steiger, was the Dodgers sports writer. And in fact, I knew about him because his son had rheumatic fever and rheumatic carditis and was also being homeschooled as I had been years previously. Branch Rickey wanted to know if on Wednesdays, when the Dodgers were in town, I could take off from school and take Joel to the Dodger games at Ebbets Field. I had very, very good marks in school. My mother discussed it with the school, and they agreed to let me do it every spring. So on Wednesday, I would get home at noon, cab would arrive, Joel and I would get into the cab and go to Ebbets Field, where we'd either sit above the dugout in the field stands because he couldn't climb stairs, or we would sit in the dugout with the players as long as we didn't talk. I was known as Hey Kid, he was known as Joe. I got many signed baseballs from the Dodgers, the Boys of Summer. I lost them, but I remember them dearly. I did well at McBurney. I became class president, eventually student government president, was editor of the yearbook, and I entered Brown University on graduation. Brown was great. My mother was very excited because her roommate from the time she arrived in New York was married to a pediatrician, pediatric cardiologist, and chief of pediatrics at the Rhode Island Hospital. They became my second family. My mother had breast cancer. During the second year at Brown, during final exams, I got a call from her cousin, who's a cardiovascular surgeon in New York, that I'd better come home right away. Came home, she was hospitalized at Memorial Hospital in New York. She was near death, but her surgeon kept on pouring blood transfusions in her, keeping her alive. Her cousin urged me to tell them to stop unnecessary efforts to prolong her life because she was really near death and they should allow natural death. I don't know how I did it. My whole family, my stepfather, my mother's 6 siblings, all they were just in shock. But I summoned my whatever energy I had and told them they had to stop blood transfusions. 11 hours later, my mother died. This had a tremendous impact on me, long-standing impact. I really devoted myself to my studies, got very good marks, entered the honors program studying Aloxan diabetes in rats, looking at protein synthesis as the effect of Aloxan diabetes on the rats. I graduated Brown and entered Tufts Medical School. I thought it was great. It was in Boston, and I loved Boston. And I really spent 4 very, very good years at Tufts. In the last year, I applied for internship and residency at Boston City Hospital. The chief of pediatrics, Sidney Gillis, was a renowned pediatrician, and it was a very exciting program. Many of the people that graduated that program went on to very outstanding careers. Ralph Feigen became president of, was one of my roommates, became president of Baylor Medical College. Jim Cherry, who was our infectious disease fellow, became head of infectious disease at UCLA. My other roommate and very close friend became chairman of pediatrics in New York at Stony Brook. So it was a great program. In the second year, I went to talk to Dr. Gillis about what my next year, third year, would be like. He said 1 minute, he picked up the telephone, dialed a number, talked with whoever he got on the phone, and he said, finally said, Norman, he said he's coming. He hung up the phone. I asked him, who's coming where? He looked at me and he said, oh, I never told you, you're going to Stanford. I was shocked. I was beyond belief. I came home and told my wife, Marjorie, we were just married a year, that we were going to Stanford. She didn't believe it until Sid Gillis had been confirmed that we were going to Stanford. At the end of that year, we packed our car and drove cross country. I wanted to show my wife, my new wife, all the sights on the way, but it rained every day until we arrived in Palo Alto. We got to Palo Alto, the clouds parted, sun appeared, and it was gorgeous California weather. We couldn't have believed the clean streets after Boston, and looked forward to a good time at Stanford. Stanford was amazing. It was this was 1964. The school had just moved from San Francisco 5 years ago. The faculty were all young and excited. Socially, it was very great, and educationally, it was terrific. I stayed on and was requested to stay on for an extra year as chief resident, which I did. I owed the military 2 years because of the Berry Plan. Berry Plan was a program that all physicians had to join or get drafted into the service anyway. It guaranteed that you could practice your subspecialty or your specialty in the military. I elected the Navy, and while I was supposed to go to Bethesda at the very last minute, the moving truck didn't arrive. I called the Bureau of Medicine in Washington. They said, oh, you're going to Camp Pendleton. We were going to send you to Far East, but the only Far East station we had was non-resident, you couldn't take your family with you. So we ended up at Camp Pendleton for 2 years. This gave me better time on call and allowed me to interview for fellowship following military service. I looked at Johns Hopkins, Yale, and was advised by Dr. Mary Ellen Avery at Hopkins that with what I wanted to do, going to UCSF would be the best opportunity for me. So I applied to UCSF, met with John Clements, discoverer of pulmonary surfactant, and William Tooley, who agreed to put me in for a United States Public Health Service special postdoctoral fellowship, which I received. John Clements is still alive. A week from today, he will become 100 years old. He's still active and very interested, and I've been invited as one of the people to do a movie presentation for John, 2-minute movie segment that will be given to him a week from today. While at UCSF, I was in the Cardiovascular Research Institute, better known as CVRI. Having John Clements and Bill Tooley as mentors was really very fortunate. I initially elected to study lung development in the fetus and selected a fetal model where I operated on the pregnant ewe, exteriorized the fetus, put in tracheal catheters, and put them back in utero, closed the incision, and followed lung development by draining tracheal fluid. I studied twin pregnancies in the last trimester. The sheep has a 150-day gestation. And what I did was, at various times during this period, I would inject one of the fetuses with steroids. We used dexamethasone at a level equal to what the fetus would experience at the time of birth, natural birth. One of the things that we found was that steroids injected into the fetus precipitated labor and delivery. And the fetuses generally would arrive about 72 hours later. I autopsied both lambs, and the injected lamb had markedly mature lungs. There were terminal air sacs and lots of surfactant in the lung tissue, and there was a large efflux of surfactant into the lung fluid as well. This formed my first publication from UCSF and was published in Journal Pediatrics. I did another study with Dr. Clements where I developed what we called a shake test. Since fetus, as it develops, has lung fluid formation. When the lung is mature, surfactant is excreted into the lung fluid, makes its way into the amniotic fluid. And if you collect amniotic fluid, I developed a tube dilution test to look at foam. Amniotic fluid, 1 cc, was diluted with increasingly large concentrations of isopropyl alcohol, and the tubes were shaken. We have a stand in front of me, count which tube still has foam in it, and that led to diagnosis of lung maturity. This study was published in the New England Journal of Medicine. In my second year of fellowship, I was asked if I was interested in putting in a grant with the other members of the CVRI on lung development. There were 6 portions, and I was to to be involved with two portions, the surfactant development, which was number 1, and lung maturity and lung physiology, which was number 6. To put in the grant, it's called the Specialized Center of Research in Lung Disease. And this was approved by the National Heart Lung Blood Institute. Gave us 6 years of funding. I was very excited because all the other programs I had looked at were not very exciting. And this allowed me to stay at UCSF and work in the CVRI. Of course, having John Clements and Bill Tooley as my mentors, I also had to do clinical work. Most of my clinical work at UCSF was in pulmonology. At the end of year or 2, as a junior faculty member, I received a number of requests from other universities to come as a faculty member. The two that were most interesting were Tufts, where my chief from Boston City Hospital had moved to become chairman of pediatrics, and Harvard, where Dr. Alex Natus, a pediatric cardiology and cardiologist and chief of cardiology, who had known me since medical school, was looking for pediatric pulmonologists. At that time, pulmonology was part of cardiology. And he called and asked if I would come and look at the job. My wife suggested I go back to look at both jobs in February. I don't know, now I know why she suggested that, but then I was totally unaware, scheduled my appointments for the week of the 18th of February. My father-in-law, who lived in New England, in Providence, Rhode Island, picked me up at the airport, and it was driving rain and 28 degrees. By the time we got to his home in Providence, in Pawtucket actually, it was 18 degrees and a blizzard. He insisted the next morning that I not take the train because it was so icy, and he would drive me to Boston. I spent 2 days at Tufts. Sid Gellis was very insistent that I take the job and very vague about what it would include. We were talking about it, and he said, let's take a walk. Walked me through the hospital into a conference room, an amphitheater. There were about 300 people seated there. And he said, do you have slides? I said, slides? He said, you're giving the presentation, aren't you? I had no slides. I hadn't been warned. I was shocked. With that, I don't know how I did it, but I thought I had a canned talk that I gave to medical students. And I got up and gave what they termed grand rounds. Fortunately, I got through the talk. Since I didn't have slides, I used the blackboard. I'm left-handed, my handwriting is terrible, but somehow I got through the talk. However, Sid didn't realize that he had frightened me from even considering the job. The next 3 days, I was spent at Harvard, at Boston Children's Hospital. They were wonderful. Alex Natus was a prince, and he showed me the ropes. I could do whatever I wanted. Search-wise, they would fund me, and clinically, I could do whatever clinical I wanted as long as I would do the exercise stress tests and interpret them on their cardiac surgery patients. That I said was no problem. After 3 days, where it looked like this is where I was going to end up, I said, you know, I haven't met Dr. Janeway, the chairman of the department yet, and we haven't talked about salary. He said, oh, Dr. Janeway would love to talk to you. Walked in to speak to Dr. Janeway. We had a lovely conversation about Harvard, the opportunities of being a Harvard faculty member. And then I broached salary. He said, oh, salary. And he told me, you get a great salary, and mentioned the salary less than what I made as a fellow at UCSF. I was making more as a faculty member as well at UCSF. And I realized that I had to tell him that there was no way I could support a family in Boston on the salary he was offering me. He said, well, that's okay. You can always say you'd been to Harvard. I said, I can say that. I'd be happy to say that, but I can't afford to come. When I went back to UCSF, I was very reassured that it was the place to spend the rest of my life. We had just built a house that my wife partially designed in Mill Valley. We're very excited living there, and we thought we would stay there. With Bill Tooley's help, I got the department head to give me a better salary than I was making, which was terrible. Salary was only a little bit better. And I thought we would stay at UCSF. However, I got a phone call from Los Angeles from Dr. Russell Mapes, who was vice chair of pediatrics at Children's Hospital Los Angeles. And he said that I had been suggested as someone who could come and consult on their starting a neonatology service and a pediatric pulmonology service, since I was trained in both. I agreed to come as a consultant. I met with Dr. Mapes, Dr. George Donnell, who was chairman of the department, the administration, faculty members, fellows, members of the task force on pulmonology and neonatology. They asked they said they'd reimburse me if I would write a consultant report. I wrote a 40-page consultant report. They actually reimbursed me for it. And then I got a call from George Donnell saying, the feeling here is that this is what we want to do, but we'd like you to do it. So a tense 2-year recruitment began. Finally moved to Los Angeles in September of 1973, making this the 50th year of the program that I started. My initial efforts were really to fortify the program. We had inadequate facilities, we had no equipment, and there was no trainees. So I recruited nursing, respiratory therapists, and especially a colleague in neonatology. I got the agreement that we would add 1 or more faculty members every year. The residents at Children's had come up with a petition for an associate neonatologist, a woman by the name of Angela Ramos, who was an attending at LA County USC Med Center and a neonatologist. In her favor, she had trained at Long Island Jewish Hospital in pediatrics with Dr. Sam Karelitz, who had been my father's brother's partner in pediatrics. And I thought he was outstanding. And her fellowship had been with Leo Stern and Bob Usher in Montreal. They had a very wonderful program, and she was an expert in negative pressure ventilation. The house staff, on the other hand, were impressed that she was an amazing clinician and an outstanding teacher, and she really lived in the hospital. We formed an amazing partnership when I finally got there. She had to start several months before me because I was having trouble selling my house in Mill Valley. We moved, set up the division, and we called it Neonatal Respiratory Disease Division. Reason it was respiratory disease, pediatric pulmonology had not been named yet. So there was an American Thoracic Society committee. Many years later, they came up with the term pulmonology, and we eventually changed the division name, the Division of Pediatric Neonatology and Pediatric Pulmonology, DNPP. My idea at Children's was that I would grow the service from within. We had several very good residents. One, Cheryl Liu, decided to stay and do fellowship with me. And I had convinced Tom Keynes, another resident, to go to Canada, to Toronto Sick Kiddies, where Henry Levison was the division chief. My idea was he'd go there and we would recruit him back and he would bring Toronto to Los Angeles. He brought Tom Keynes back to Los Angeles, and he had many ideas and has had a wonderful career with us. A year later, I recruited another attending, Dr. Frank Sinatra. He had been chief resident when I arrived at Children's and had gone off to train in pediatric gastroenterology with Dr. Phil Sunshine at Stanford. Phil was both a gastroenterologist and a neonatologist, so all of his fellows could do neonatology as well as gastroenterology. Frank came back and I recruited him as a faculty member with the agreement that as soon as Children's established a gastroenterology program, he could leave neonatology and I would recommend him for chief of gastroenterology, which he did, and Dr. Donnell appointed him chief of GI. We had quite a bit of challenge at Children's. The service grew very, very rapidly. We added fellows rapidly, and we added faculty rapidly. What should I tell you? We had upgraded neonatology program, which had been non-existent. We had started pediatric pulmonology, and we had a good faculty. We had many trainees. Tom Keynes' his habit calling the graduating trainees the long gray line. And we probably have 100 of those in our gray line. What else did we do? We did a lot of physiologic studies. I had been very interested in the growing lung, and when at Stanford, I had seen babies that had respiratory failure at birth. Those that were successfully ventilated tended to have chronic lung disease following assisted ventilation. Many of them died. Our great pediatric radiologist, Bill Northway, and two pathologists, Corky Roseanne and Phil Porter, studied the lungs, x-rays and pathology in the lungs of these babies and described a radiopathological disorder that they called bronchopulmonary dysplasia. This was actually a chronic lung disease of infants. And the question was, would they ever not have lung disease? Would the lung grow and develop normally if we gave good therapy? We studied the effects of bronchodilators, diuretics, two different kinds of diuretics, furosemide and hydrochlorothiazide on lung mechanics in these infants with chronic lung disease. And these papers were reported in the literature subsequently. To this day, about 60% of the infants born prematurely who had respiratory distress at birth go on to have the chronic lung disease. And one of the dilemmas and unknown issues is whether the lungs ever recover. We studied children up to the age of 11 and found that they had problem with hyperinflation of the lungs, increased airway resistance or obstruction of the airway, and reduced lung compliance. It's unknown whether the lung ever recovers. Today, with increasingly smaller infants being born and surviving prematurity, the question is a very pregnant one. So we did a lot of clinical research, and I'm very proud that many of the faculty went on to carve out research in other areas, such as apnea, ventilatory control, and assisted ventilation. I don't want to spend too much more time, give you time for questions. I had several projects that I have been alluded to. I did extramural work in 1988. I received a call from Mike Moore, the Secretary of State of Mississippi, who said I had been recommended as a witness for him. He was going to sue the tobacco industry for $8 billion. I said, I have no expertise in that area other than knowing the literature. He said, one of my colleagues at Harvard School of Public Health had said that I knew a lot more than I was willing to admit. We had collaborated on a paper and used his work on infants born to mothers who smoked and their lung mechanics. And I had used them as a control for another study that I was doing that I'll discuss in a minute. I agreed to be a witness for Mike Moore. And I would do it pro bono because I didn't feel I could accept money for testifying against tobacco industry. I was subpoenaed and told that 100 attorneys would come to LA to take my deposition. Turned out that there was only a small number of attorneys, but all of them had online attorneys from other firms representing all of the tobacco industry. I testified for 8 hours, and at the end of that time was excused. The next week, tobacco industry settled with Mississippi, awarding them $8 billion. Never went to court. Another study that we did was on HIV. I had been interested in chronic lung disease and in interstitial lung disease. And I had suggested to the NIH that we do study. I had put together 8 centers across the country that had good pulmonology, pathology, radiology, and we would study these rare interstitial disorders in childhood. The proposal was turned down, but I got a letter from Sue Hurd, who was head of the lung section of the National Heart, Lung, Blood Institute, saying that they were willing to fund another study on interstitial disease caused by HIV. And the protocol was we would study children delivered to mothers with high-risk behaviors, some of whom had HIV and others just high-risk behaviors, prostitution, cigarette smoking, cocaine. Study was approved, but they took our control group away, mothers with high-risk conditions, but not HIV. And that's where when I collaborated with Harvard School of Public Health to get their data on infants born to mothers who smoked. So we had HIV mothers, and about 12% of their babies had HIV, and mothers from Boston with weight and age matched babies, and we studied their lung mechanics. All of this was published. I don't want to take more of your time. I'd be happy to answer any questions, but I hope some of the work that we've done will raise issues about whether infant lung diseases are the prerequisite to a lung that in the adult that is abnormal. I'd be happy to answer your questions.
Well, thank you, Arnold. That was really fascinating. What a career. I'm sure people have questions or comments. Feel free to use the chat or raise your hand or just jump in. Anyone
Hi, so I'm Tom Keynes. So Arnold, marvelous, fantastic. But I think you failed to give yourself credit for one other thing that you did that, of major importance, which was mentorship. Um, when you first arrived, I was a resident in Children's Hospital Los Angeles, and I knew I wanted to do pulmonology, but there were no computers. You know, you couldn't look up fellowship programs. And so you sought me out. You heard that there was a resident interested in pulmonary and kind of, you know, got me, came in the office and said, you need to go to Toronto. I'd never even heard of that fellowship program before, but you basically shaped my career. So I did go there. You enticed me to come back, and I've had a wonderful career, but it was largely due to the fact that you were supportive of everything I wanted to do, in addition to making suggestions about things that I should do. So your mentorship is spectacular and legendary, and an equally important part of your legacy.
Can I jump in? This is Lawrence Ross. I was PEDS ID staff at Children's for a long time. And I started my training at the time that Arnold arrived at Children's to develop the program in neonatology and respiratory diseases. And Arnie, I congratulate you on a wonderful presentation today and on an obviously tremendous career. But as I look at the attendees I can see here, the thing that you exemplified for me, along with all these other people I've worked with, was setting a standard of excellence at every level and at every endeavor one took. And in retrospect, it was such an honor to be able to work with people of your excellence and your demands for excellence and not accepting for mediocrity. There are so many anecdotes I can give of your support for me as a person, for our patients, going out of your way in patient care. And I think I see Richard McKenzie sitting there. We often muse about how we were able to work, study, and achieve in the atmosphere that you and others created for us, that demanded the highest of standards of ethics and care. Thank you.
Thank
Hey,
you.
Arnold, I'm going to jump in. Since you graciously mentioned me as one of your first acolytes, I was, if you'll recall, your first senior resident in the newborn intensive care unit, which you transformed. You brought it into the 21st century, or I should say the 20th century at the time. And it was a transforming experience for me for several reasons. One, the saying that I still, at least until I retired about a year ago, preached to my learners, that discharge planning begins on the day of admission to the hospital, which I hope that I see that the current pulmonary fellows are on this call, and I hope they take that to mind. That you also focused on family-centered care, and we're really in the 50 years plus years I was at Children's Hospital as a trainee and a faculty member, we're the first to have introduced that notion to Children's Los Angeles. And thirdly, your inclusiveness in terms of developing a true interdisciplinary healthcare team, not just in that you actually contributed to creating the state's standards for staffing in newborn intensive care units. And I don't think that, well, one, you didn't mention most of that stuff, and I don't think you're given as much credit as you deserve for all of those developments. So, and also, by the way, you're probably the reason I became a bioethicist in addition. And I was moved to hear your personal experiences. It shaped your view about understanding the importance of supporting good end-of-life care. And the reason I became a bioethicist is that you, when I was a junior faculty member, began to invite visiting faculty from USC to come to our division to give us little mini talks and sessions on decision-making and the importance of understanding the moral framework for decision-making, especially in critical care. So congratulations, Arnold. We should get together one of these days and share some wine.
Yes.
If I may chime in, Dr. Platzker, this is Sheila Kuhn. I have worked with Dr. Platzker for decades. I began working with you when I was working with Dr. Seymour Cohen. So you are a great collaborator to begin with. Then when I moved to pulmonary, I think the word that came to mind to describe you is you are a gentleman. I have never seen you get angry with families at all. And I remember with one very, very difficult family, most people would fire them on the spot, but I think you could not fire that family. And I still remember how you said it. You said, I think you're better off working with my other colleagues. So you are a true gentleman and an excellent clinician.
Thank you.
Here's a question from a non-physician. Just something I was wondering about as you were speaking. Did your early experience with polio influence your subsequent career and the choices you made?
I don't think so. I came from a family where the only one who wasn't a physician was somebody who couldn't stand the sight of blood. My father was one of those, and he became an attorney, but his older brother was a physician's physician. So I think my focus on medicine had a lot to do with my uncle, my mother's cousin that was a cardiovascular surgeon, chief at Mount Sinai in New York. He was a very forceful mentor. My mother and he were very close. And when I came home from college, there would always be a message that your cousin Irv will see you in the operating room tomorrow at Mount Sinai at 5 a.m. And I went, and he was a very, very wonderful, sensitive cardiovascular surgeon. The only time he wasn't sensitive was in the OR. He was wonderful with his patients, but very impatient with anyone working with him. But my long-standing concerns and interests in medicine were well set well before I had polio.
Well, as a former baby that was born early, I had hybrid membrane disease. So I just wanted to say thank you on behalf of all the little babies that you saved, because you probably saved a lot of babies just like me. So thank you for your work and all that you did.
I'll tell you a funny story. It wasn't so funny when it happened to me, but at least 25 years ago, I had severe back pain, so bad I couldn't walk. Saw a neurosurgeon who said he didn't want to operate on me and referred me for epidural steroid injection. And he told me it'd probably be weeks before I could get in to see this doctor. I called. The secretary said they'd schedule me in X number of weeks. I got a call back 20 minutes later with an appointment for the next day. I went in and got the steroid injection into my epidural space and was pain-free in seconds. I looked at this man and I said, I was told it was going to take weeks for you to see me. He said, well, you saved my son at birth, and he just had his first child, and I want to thank you. For the life of me, I don't remember his son must have had the mildest case of respiratory distress, because I don't remember. I remember names and faces and never remembered him. But obviously I must have said something or done something that stayed with him forever.
Arnold, did you place some of your fellows at Cedars-Sinai Hospital in Hollywood, the old Cedars?
Well, that Cedars closed and merged with Sinai about a year after I came.
Ah,
So none of it. In fact, several of the people, when I was looking for an associate neonatologist, several of the people that worked at Cedars interviewed with me. I just didn't take any of them.
but did you place your some of your best trainees over there for clinical experience?
No,
No, okay.
we had one of our fellows, Andre Vanderhaal, who spent some time at Cedars as an associate neonatologist.
Mm-hmm.
But I think he's the only one that we had go there.
Okay, thank you.
Well, is there anyone else who'd like to ask Arnold a question or make a comment or anything? If not, I think we're.
Well, right. I have one more.
Mhm.
I'm just curious, given the history of Los Angeles with terrible smog, is that part of the reason that Children's Hospital and Dr. Russell Mapes were so eager to build this field of pulmonology at Children's?
Well, Russ Mapes was an interesting guy. He had been in practice in pediatrics in Beverly Hills, but was very politically involved in pediatrics nationally and became president of the American Academy of Pediatrics. He was a wonderful gentleman, very good clinician, very good administrator, but had nothing to do with the request for neonatology and pulmonology at Children's. This was a task force that was set up to start these programs because residents, pediatric residents at Children's, were very unhappy with what was going on
Thank you.
in those areas.
Dr.
Arnold?
Platzker, can I ask one question? Your career really spanned the time in which pediatrics became a series of specialties, and you helped to create one of the specialties. How do you think that's helped or not helped the care of children?
I think it really improved the care. I should say that my first chairman, Sid Gellis, was a renowned pediatrician. And he was one of these people, regardless of the patient's problem, could give very, very good advice. Today, people like Sid Gellis, Dick Goldblum don't exist anymore because pediatrics is a short-term office visit. We have hospitalists, so the diagnosis and treatment, usually in hospital or sent through consultants. But there's still an important place for good general pediatricians. But there will never be another Sid Gillis. He was very close to me and used to take me with him when he went to other hospitals, mainly Boston Children's, to consult. And I saw him consult on cardiac cases, neurology cases, neonates, and he had something to offer. Today, you couldn't do that.
I have a question for you, Arnold, and I can call him Arnold because he's on our board. Highly respected and wonderful. I will make sure that we capture everyone in the chat because they're all thanking you too. But what made you finally decide to become an emeritus professor? Because you're still connected, you're still providing advice, and the research shows that the older we get, the better able we are to problem solve and give consulting advice.
Well, Jeanette, I'll give you two bits of advice. When I came to Los Angeles with only one associate, I was in the hospital night and day because often it took two of us to supervise a growing unit. It got so bad that one time I came home at about 2:33 in the morning to take a shower, change my clothes and go back, and found a paper bag on the front doorstep with change of clothes, a towel, and my toilet articles. That was a hint from my wife. Second of all, getting up in the middle of the night every night is very difficult and it dulls your senses. I think the other people on this call who have done neonatology will tell you the same thing. Very, very difficult. A friend of mine, Rod Phibbs from San Francisco, calls neonatology a young person's sport. And that's really true. So that's about neonatology. As you get older as a pulmonologist, you end up getting referred all the most difficult cases that nobody else wants to look at. Wearing. And my wife will confirm that one day, about a year and a half before I retired, I got up and said, this has got to stop. I'm going to retire. Just was too much. In addition, some of our patients die. When I started in cystic fibrosis in 1962, the average age of survival for a patient with cystic fibrosis was 8 years old. Today it's well over 60. Times have changed, but we still see patients with cystic fibrosis and other lung disease die. I used to go to the funerals, and that's wearing. Takes a lot of energy. Mm-hmm. So at some point, people say, I'm throwing in the chips and getting out while I have time to spend doing other things. So I raise grapes, orchids, and keep myself, I still read the New England Journal every week and the pediatric journals. and the American Journal of Respiratory and Critical Care Medicine. But I'm not an expert. And I'm glad that I retired when I did.
Do you have any advice for those that are coming up in the ranks?
No, when I think one of the things that I did is every time a door opened, I went through it to see if that's where I wanted to go. And I think another story, one of my two mentors in San Francisco, Bill Tooley, very handsome, 6'6" guy with a voice that sounded like Greg Peck. He was born and raised in Berkeley, went to UC Berkeley, did training, and then came as faculty member at UCSF. He was one of the most important men in the field and was early in his career offered jobs everywhere. And he would turn them all down. And finally, people stopped asking him when he might have even considered them. He told me. So his advice to me was never say no. If somebody offers you an opportunity, at least consider it.
Laura, I think you had a question or a comment.
Yeah, what is the modern name for the hyaline membrane disease?
RDS, respiratory distress syndrome.
And have there been long effects from that? Long-standing?
Yes. You don't know. One of the problems of prematurity is you're delivered before all your organs are completely formed. The lung is probably one of the slowest to form, and it continues to develop new units, at least up until 2, some people say 8 years of age. If you're delivered early, it's almost like a clock stops and nothing, you're caught developing with what you have, which limits the number of units the lung will eventually have. So if you have RDS, probably at risk for lung disease that may last into adult years. That's why I ended by saying our pediatric lung disease, the precursors of adult lung disease, chronic obstructive pulmonary disease. I think so.
Was that the 40%? Was that the 60% you were talking about, or was?
Yes.
Okay, so 40% of them have no after effects.
Well, that's not true. But that 40%, if you study them hard enough, you'd find some problems. I'm sure. But that's 60% of people, when they get a cold, have a longer time getting better, tend to wheeze, etc.
Well, does anyone else have questions or comments? Arnold, this has been really fascinating to me, and I'm not in a field anywhere near medicine. And it's been so interesting to hear about your career and all the things you did. I'm glad that some of your colleagues filled in where you were too modest. You learned a lot more too. But it was a wonderful talk and wonderful discussion. So thank you all for coming. I just want to mention that Our next speaker will be Pierrette Hodognu-Sotelo in sociology in Dornsife College, who's done a lot of really good work on issues surrounding immigration. And we haven't quite fixed a date yet, but it will be in the coming weeks. So please do watch for an announcement of that.
Thank you, Greg.
Thank you very much.
Thank you, Arnold. Thanks everyone for coming. We'll get this video up on YouTube, and it's part of our Living History project as well as the Intellectual Journey series. So give us a couple of weeks to get it all spruced up to make sure that there's a beginning and an end, and then we'll get it up on our website.
Thank you, Jeanette. And thank you, Greg.
And thanks to everyone for coming and taking part.
Right. Thanks, Arnold. It's wonderful to see you, and thank you so much for doing this, and take care, everyone.